Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the spontaneous pneumothorax, that is etiology, rupture of the blab, rupture of the bronchopleural fistula, rupture of the air-filled blister in a healthy person, may be associated with the severe emphysema or the intestinal lung disease. Traumatic pneumotherapy, there are pneumatic thorax would be bound in the chest wall, allow air to escape, enter the pleural space, causes the blunt trauma, penetrating chest trauma, abdominal trauma, diaphragmatic tears, invasive thoracic procedures, the hemothorax, collection of the blood in the pleural space resulting from the torn intercostal vessels and the lacerations of the great vessels and the lacerations of the lungs, pneumothorax, air and the blood. Sucking chest wound, a type of the traumatic pneumothorax allow air to pass the fill in the outrush of air through the whole procedures, a sucking sound, consequence, mediastinal flutter. Clinical manifestation. There are the pleuritic pain, tachypnea, and anxiety, dyspnea with the air hunger, use of the accessory muscles, decreased or absent breath sound, decreased movement in the affected side, subcutaneous emphysema. Management is the goal, evacuate the air or the blood from the pleural space, pneumothorax, small chest tube, second ICS, hematothorax, large chest tube, suctions 20 mm Hg suction, antibiotic therapy, helmetic chest tube to water seals, drainage, emergency, thoracotomy. Next is the nursing care of the chest drainage system. Fill the water seal with the sterile water to specified levels. Fill the suction control chamber with the sterile water to the 20 centimeter level. Attach CTS to the collections chamber and tape suction day. Dry systems turn regulator dial to 20 centimeter H2O suctions. Wet system turn on the suction until unit steady bubbling appears in the suction control chamber. Immediate petroleum gauge. There are the parietal pleura, visceral pleura, lung space, ribs cage, diaphragm, second intercostal space to remove the air to drain fluid and blood, rib cage. Interventions, chest tube drainage, mark the drainage from the CT, check for the loop in the CT, what is the milking the tubes, what is the tidling, observe for the air leaks, do not clamp the CT for the transport, incentive, spirometer, cuff and DB, observe and report change in status. Chest tube removals, wall saliva, there are the maneuver per client chest tube, the claim, the quickly remove pressure